CyraCom provides over-the-phone medical interpretation to help healthcare providers communicate with patients who are limited English proficient, or LEP. CyraCom's quick and easy access to trained medical interpreters allows healthcare providers to deliver effective patient care in any language. When seconds count, CyraCom's interpretation service is available 24 hours a day, every day. CyraCom's Client Services Department is also available around the clock to assist you. This training session is designed to help you get started using CyraCom's over-the-phone interpretation service. After completing this training, you'll be able to identify your LEP patient's language, access a medical interpreter, and work effectively with a medical interpreter. Let's get started. Identifying your patient's language. If you need help identifying your patient's language, begin by asking your patient which language they prefer to speak, or use the CyraCom Language Identification Chart. This chart is translated into commonly requested languages with the phrase, "Do you speak? Name of language? We will telephone for an interpreter." Simply show the chart to your patients and have them point to their preferred language. You may also call CyraCom's Client Services Department if you require further assistance in determining your patient's language or need to order language identification charts for your department. Accessing a medical interpreter. There are multiple access methods for connecting to CyraCom medical interpreters. The most common is using either ClearLink or ClearLink Cordless, CyraCom's Blue Dual handset phones. You can also use any telephone within your facility to make outbound and receive inbound calls and connect to an interpreter quickly and easily. For more information on access methods, view the Additional Features portion of this video. ClearLink Blue phones are specifically designed for medical interpretation. You'll notice there are two handsets. One is for you, the provider. The other is for the LEP patient. Each handset is equipped with adjustable volume controls. The headset jack and the speakerphone option allow for hands-free communication. The pre-programmed buttons contain account information for fast and easy access, so there's no need to memorize any numbers. ClearLink is portable, and the durable carrying case makes storing the phone and moving it between patient rooms trouble-free. Instructions for using ClearLink are included on the face of the phone and on the attached laminated instruction cards. The phone is typically stored at the nurse's station. Ask your unit manager where your department stores your ClearLink phone. To use your ClearLink phone, you must first plug it into an analog phone jack. This is a single-line phone jack, such as those commonly found at a patient's bedside. To access CyraCom's interpretation service, pick up the left handset and listen for a dial tone. Then press the blue button labeled Access to automatically dial the toll-free phone number. Press the white button labeled Account PIN, and this will automatically enter your account number and PIN. Once you have successfully entered your account information, you'll be prompted to make your language selection. Say the name of the language required. For example, say Spanish or Russian.
Russian.
Your language selection will be repeated to you for confirmation. Confirm your language selection. You'll then be prompted to select whether you would like to add an additional person to the interpretation session by calling their phone number. For example, in addition to having the interpreter and the patient on the call, you may need to conference in a remote doctor or family member. With this option, you can also make outbound calls to an LEP patient at home with the interpreter on the line with you. For example, to set or cancel an appointment. If you'd like to add an additional person to the call, select the prompt and follow the instructions. Please note that you can press *8 at any time during your interpretation session to add an additional person to the call. For more information on adding an additional person to the interpretation session, please view the Additional Features portion of this video. Working effectively with a medical interpreter. There are a number of tips that you can follow to ensure effective communication during your interpretation session and enhance your experience. First, when the interpreter comes on the line, allow the interpreter to greet you and provide you with an interpreter ID number. The interpreter will explain that everything in the interpretation session is repeated and kept confidential.
Good morning, CyraCom Russian interpreter 512962. I will repeat everything you say and keep it confidential. Please speak in the first person and use short phrases. May I help you?
Hello, interpreter. I'm a nurse calling from the ER at Regional Medical Center, and I have a patient here with me who I need to get general information from before the doctor can see her.
Okay. May I introduce myself to the other party?
Please do.
Доброе утро! Я буду вашим английским переводчиком. Я буду повторять все, что вы будете говорить, и буду сохранять конфиденциальность. Пожалуйста, говорите от первого лица и используйте короткие фразы. Go ahead, ma'am.
Remember to speak directly to your patient in the first person, as if you were speaking the same language, and use short but complete phrases.
Please tell me what brings you to the emergency room today.
Пожалуйста, скажите мне, что привело вас в отделение неотложной помощи сегодня?
Последние 2 дня у меня держится высокая температура.
I have had a fever the last 2 days.
What other symptoms are you having? Any nausea?
Pay attention to any visual clues which may support your conversation. Avoid slang, jargon, or metaphors. Allow for the interpreter to clarify any linguistic or cultural issues. Remember that everything you and the patient say will be repeated. This means that the interpreter will interpret everything, meaning for meaning. Please keep in mind that it may take longer in the other language, and the interpreter may need to ask for clarification from you or the patient.
Are you on any medications?
Вы принимаете какие-нибудь лекарства?
Нет, но я принимала Tylenol, пытаясь понизить мою температуру.
Let the interpreter know when the interpretation session is finished and disconnect from the call.
Thank you, interpreter. That'll be all we need today.
Thank you for using CyraCom, interpreter 512962 disconnecting.
Let's review some of the key points for using CyraCom's over-the-phone interpretation service. Start by identifying your patient's language by asking them directly or by using the CyraCom language identification chart. Then access a medical interpreter using ClearLink or any other telephone within your facility. If you're using a ClearLink Blue phone, be sure the phone is plugged into an analog phone jack. Then press the Access button and follow the voice prompts to connect to a medical interpreter. To add an additional person to the interpretation session by calling their number, select the prompt when accessing an interpreter and follow the instructions, or you can press *8 at any time during your interpretation session to add the additional person to the call. When the interpreter comes on the line, allow the interpreter to greet you and provide an interpreter ID number. Write this ID number down in the patient's chart or progress notes. Speak directly to your patient. Use short phrases, and remember, everything is repeated.